A growing divide over AstraZeneca's COVID-19 vaccine. The World Health Organization has urged countries not to halt rollouts over blood clot fears. And for a closer look at these safety concerns, we're joined now by Dr. Jonathan Gibbins from the University of Reading. So let's talk numbers first. 40 cases of blood clots out of 17 million people in Europe who took the vaccine. I mean, is there even a need for a debate on the safety of it?
I think it is right that authorities look very carefully at new medication and make sure that there aren't adverse effects. That said, the really tricky job is to make sure that what we're observing isn't more than you would expect in the population already. And I think the assumption for your question is correct in that the levels of unwanted clots, dangerous clots, are actually quite high. It's a relatively common event. And so the numbers that we're talking about in some of the reports that have come from countries across Europe are actually substantially lower than the numbers we might expect to happen anyway.
Dr. Gibbins, all of the vaccines that are currently being used, those that have been approved, have reported side effects as well, different ones perhaps, but why has the AstraZeneca one been singled out specifically?
That's an interesting question. It's hard to say. I think it's certainly across Europe and in the UK, the AstraZeneca vaccine was one of the first that was released, and there's probably more data on that. But I think what we're seeing is a normal process, and the data will be scrutinised for all of the vaccines. It's just unfortunate that for reasons that are not entirely clear, the AstraZeneca vaccine has become the focus at the moment.
Now, the WHO, I mean, they're still discussing the matter, although, they have said, not to halt the rollout. But does this suggest that its experts are still worried, after all, despite having said that, AstraZeneca vaccine is safe?
No, I don't think there is worry. I don't think there's panic or major concern. As I say, I think this is part of the normal process. I think we do need to handle this very carefully because the reality is, as I've just said, that the numbers are very low. But in fact, infection with COVID carries with it a very high risk of clotting, and this is life-threatening. And so there is an argument that if this whole process scares people, it prevents people from taking up the offers of vaccination, we may actually make the situation worse because we won't be protecting people from clots that would have been protected.
Dr. Gibbins, we have a limited number of approved vaccines that are being used around the world. How much of an impact will removing just this one vaccine from that chain have on this global vaccination efforts that we're currently in?
I think it's a good point. I think the success of a good number of vaccines is somewhat of a medical triumph. It's something that's very encouraging for the year or so ahead of us. I think potentially it can be damaging if one vaccine effectively has an effect that affects people's willingness to actually have the vaccine. But I think that would be relatively short term. I think there is an argument that removing one vaccine is potentially not so much of a problem, although it does depend on which parts of the world that's being used. And I think certainly in the UK and until recently in other countries in Europe, the AstraZeneca vaccine was commonly being used. When we do run the risk that we reduce the chances of reaching population level immunity as quickly as we need it before there's another wave of infection.
So, Dr. Gibbins, bottom line, to use or not to use?
I would use. I'm waiting for my invitation and I won't hesitate.
That's good to know. Thanks very much, Dr. Jonathan Gibbins there from the University of Reading.